Hi, my name is Meghana Giri, and I'm a medical student at Columbia University. I had the pleasure of designing, implementing, and analyzing a pilot study investigating the effects of air pollution on lung health in Washington Heights, a neighborhood in New York City, with Dr. Stephanie Levinsky-Desir. For some background, exposure to traffic-related air pollutants, including fine particulate matter called PM 2.5, is a known contributor to asthma and airway inflammation. Children who live in Washington Heights are exposed to high levels of PM 2.5 produced by vehicles that traverse the George Washington Bridge, which is the busiest motor vehicle bridge in the world. This has contributed to pediatric asthma rates in Washington Heights that exceed citywide rates. In order to address this disparity, we launched a pilot study with local high school students and an environmental justice organization called Futures Ignite. We aim to first, explore the associations between pollution and airway inflammation, and second, assess the feasibility of deploying personal air monitors to teens. 10 students underwent a 72-hour sampling period in which they wore an accelerometer watch, a personal air sampler called a U-Pass, and a GPS tracker in a crossbody bag. Each day, we recorded students' transportation methods and measured their fractional exhaled nitric oxide, or FeNO, as a marker of airway inflammation. At the end of the study, we held a focus group for feedback and calculated monitor adherence by comparing the U-Pass and the watch accelerometers. When analyzing the data, we stratified FeNO at 26 parts per billion, which is the pediatric threshold for diagnostically high airway inflammation. There were exactly 5 students above and 5 below this threshold for their entire sampling period. To investigate this trend, we compared exposures between these two groups. As shown in Figure 1, we found that students with a higher average FeNO were exposed to higher levels of PM 2.5 while commuting, were more likely to commute via bus or subway, and spent more time above the Environmental Protection Agency's daily PM 2.5 threshold while commuting. Regarding our second aim, 100% of students were adherent to wearing the U-Pass, and 80% said they would wear it again. Additionally, during our focus group, we provided each student with a handout that displayed their personal PM 2.5 exposure on an interactive map. When we asked students whether they would change their commute after seeing their personal data, 70% said yes or maybe. Overall, in our small pilot study, significantly higher PM 2.5 exposure was associated with increased airway inflammation, particularly for students who commuted by subways and buses compared to walking and car and/or taxi. Thus, students are being exposed to not only high levels of ambient PM 2.5 from the traffic in Washington Heights, but also high levels of PM 2.5 from public transportation they use on a daily basis. These compounding sources of PM 2.5 exposure can contribute to worsened lung health. Finally, one of our most exciting results is our successful data collection process, which shows that engaging community organizations and teenagers in air pollution monitoring is not only feasible, but that our strong partnerships also enabled us to conduct important research that can influence change on an individual behavioral level as well as the community level. In fact, many of our students in the study are working with Futures Ignite to advocate for the pedestrianization of 5 street blocks near the bridge, hoping to reduce their ambient air pollution. Going forward, our lab is excited to expand our project and further study the effects of personalized data dissemination on behaviors as we continue supporting student-led advocacy for greener environments. Thank you.